Hi guys, I'm Dr. Andrew Iraniha. Today I wanted to answer a very common question my patients ask me in my practice, how they know whether they have diastasis recti or not. So essentially, diastasis recti is a separation of the abdominal wall muscle, especially the center of the abdomen, which we have two muscles next to each other called rectus abdominis muscle, and those muscles are vertical muscles from the attached to the rib cage on the top and then the pubic bone below, and they kissing each other right in the center. And then because of different issues including post-pregnancy or obesity, these two muscles are separate from each other and create a gap, a very large gap, and that cause an abdominal wall bulge or pooch. And especially we see that post pregnancy for female who are thinner and more petite, and you can see even after many months post-pregnancy, after many hours of exercise, they still have that poochiness of the abdomen, and they don't know whether that issue is going to go away or not. And essentially, this is the anatomical defect. Obviously, with exercise, you can make the muscle stronger. However, that gap is still going to be there. So in order to know whether you have the diastasis recti or not, the best thing to do is to lay down on a flat surface and then try to do a crunch, like you bring your head and chest up and tighten your abdominal wall muscle, and then feel the rectus muscle on the side, and then see how much gap you have in between these two muscles. And majority of patients with a large diastasis recti, they actually have a very large bulge, which is vertical, mostly from the top of their abdomen towards the umbilicus, and it's like a big lump, straight lump from the top to the bottom, and that way they can even put their finger inside and see and feel the defects and see whether they have diastasis recti or not. If you have any question or concern, or you want to know about the different techniques that we offer to fix the diastasis recti, please contact my office at 949-646-8444. Thank you.